what is the first thing that a parent can do if they feel that they have a child that might be exhibiting some of these behaviors, and where they know that that child has an opportunity to maybe be alleviated from some of those symptoms? What's the first thing that they should do?
Yeah, I think if you're just getting started, really the fundamentals are food. Cut sugar out, cut preservatives out, cut food colorings out. Make sure they're eating wholesome foods that don't disrupt their blood sugar. And that alone may change, 10, 20% of the picture, sometimes more. Sometimes it changes the entire picture. So I think at a core foundational level, start with food. And then, from there, then you can get into all of the nitty-gritty details of sleep and tongue ties and mold and gut issues and mitochondria and so forth. But nutrition is foundational. And I'd say, at the very least, just start with the very basics.
Hi, everyone, and welcome to the Eat Real to Heal podcast. I am your host, Nicolette, and on today's episode, we have an amazing human. He is somebody that works with kids, and he is building resiliency in children all across North America, and particularly in California. Dr. Pejman Katiraei is a board-certified physician who's also trained in integrative and holistic medicine. So you all know how much we appreciate that, because of the fact that so many of us put our physicians on pedestals. They go to med school, they study from anywhere from, 6 to 10, 11 years, and they graduate. And, because of society, we have said, you know what? Doctors know it all, but that is actually furthest from the truth. We put so much pressure on doctors to be able to try and figure out everything there is to figure out about our life. But one of the major contributors to our poor health, especially today more than ever, is our lifestyle. So doctors are no longer doing house calls, coming into your home, checking to see what's in your fridge and how you shop and what the different ways that you cook. Doctors barely even get the opportunity to touch your skin and feel if it's clammy or sweaty or hot or cold. They don't often look into your eyes to see, if your pupils are dilated, or look at your tongue to see if there's a buildup of, extra, material and mucus. Those days are really far behind us, because doctors have so much pressure to pump patients through the door. They have 7.5 minutes to be, to try and diagnose and prescribe and treat and get you out the way before they have to sit there and fill out all the insurance forms that they are having to fill out just so that they can get paid. It is not a glamorous, easy job. But one of the things that we can do is we can actually just take our physicians off the pedestal and take responsibility for our own health. And that is something that I love about any practitioner that has studied both Western medicine and Eastern medicine, allopathic medicine and alternative medicine. It's because any physician that has gone above and beyond to do that, they don't have to do that. They don't have to spend their money and time studying alternative health and other Eastern philosophies. But when they do, man, you are seriously, it's going to change your life, because this is going to be a doctor who looks at you and your body as one complete system, and one system that is integrated into the complexities of your life, nobody else's life, but your life. And this is what Dr. Pejman Katiraei does, otherwise known as Dr. K. So he completed his undergraduate at UCLA, and then he went on and he obtained his osteopathic medical degree at Western University of Health Sciences. From there, he went on to complete a pediatric residency at Loma Linda University, an incredible university that's just doing such progressive studies and research. So definitely look at the research that's coming out of Loma Linda. And then he went on and he stayed teaching on the teaching faculty for over 4 years. So Dr. Katiraei, without, spoiling everything that we're going to learn in this podcast, he's going to teach you how he and his clinic builds resilient kids. And right now, more than ever in 2021, that is what every single parent, every single teacher, any single community leader needs to be focusing on, is how do we raise holistic kids, resilient kids. And in fact, that's the name of Dr. K's work and clinic, Wholistic Kids. So let's dive into the podcast with him. I don't want to jump in ahead of myself because you're going to be learning so much. And I truly cannot wait for the borders to open so that you can bring your child, if they're suffering from chronic illnesses, mental health conditions, if they're suffering from anything and everything, please make sure that you get on Dr. K's waiting list and you get him to help you and your family, because he'll be able to help you reclaim your own health, your child's health, and really be able to get you back to living the beautiful, amazing life that you were born to live. Now, before we dive into this podcast just yet, I want to make sure that you head on over to our website at nicolettericher.com or 22million.ca or richerhealth.ca. We have lots of sites out there. Everything is in the show notes. And we had launched an incredible program this summer called Get Off Your Fat Ass. That's right. I want you all to get off your fat asses. And when we're talking about fat, this is what we mean. We mean that you are fabulous. You are amazing. You are authentically you. And most importantly, you have the power to transform your health, to transform your life, and to really rebuild your body into one of 2,000 different versions that you are capable of transforming yourself into. Isn't that amazing? Dr. Zach Bush says 2,000 different versions of yourself you can create simply based on the decisions that you make today. So without further ado, get on that waiting list and let's dive into this show right now with Dr. K.
Hi, everyone, and welcome to the Eat Real to Heal podcast. I am your host, Nicolette Richey, and on today's show, I am very excited to welcome Dr. Pejman Katiraei. Welcome.
Thank you. Thank you for having me. It's really a pleasure to be here.
It's always exciting for me to interview doctors that work with kids, especially because right now we have, millions of kids in North America that have been born post 1986, post the era of like mass pesticide use, where we have so many chemicals going into our environment that are untreated or that are not well tested, and we're just getting inundated with these, environmental stressors, coupled with all of the digital technology that our kids are being raised in. And I liked following, theories of psychologists and other medical doctors and practitioners out there that often talk about these cumulative stress disorders. So it's these micro stressors that are on our systems. And as adults, we may or may not be able to manage them well, but what about the kids that are being born into this world? And I just know that so many of them need a physician like you. So let's start with that. And I know I'm just coming in with guns blazing, but I think it's really important to talk about this because you deal a lot with kids who have neurological disorders, they have ADHD, other mental health disorders. And what are you seeing now, in 2021 that, you might not have been seeing a decade ago?
Well, great question. Also a pretty complex question.
Yeah.
I think there are the obvious things. For instance, one of the things that is really coming to, I think, that the country's and world's attention is, this pediatric neuropsychiatric kind of acute onset syndrome where these kids are basically losing it and they're aggressive for no reason. I mean, some of them, these poor kids, are basically being labeled as, psychotic, and they're being put on antipsychotics. Some of these kids are getting the diagnosis of autism or autism spectrum. but their entire neurological manifestation makes no sense, and it's truly puzzling, and it's, I think, becoming much more of a problem than what we ever knew before. And some people would say, well, is it just that we're becoming more aware of it? And I think along the lines of the autism spectrum, we now know that autism spectrum, and these are normal typic kids. They look at you, they talk to you, they're able to socialize with you, but they're literally unable to just regulate themselves. And when we look at the data, what we find is that a decade or two ago, let's say a decade ago, when our diagnostic standards hadn't changed that much from now, there has been a noticeable increase in the presentation of these things. But it's not just that. We are seeing, increased rates of atopy. One of the things that's really irking me as a general pediatrician, and I wear two hats in my practice. I'm the general pediatrician that just sees cute little kids grow up, and I see them from birth onwards. And then I'm also the diagnostician or the consultant, where about 30% of what I do is deal with the I call them lovingly my train wrecks. I see the kids where literally everyone else throws up their hands and like, I don't know what's going on with your child, good luck. And they've seen like 5 or 10 doctors, and they've have half the patients that have the means have literally traveled the country going from doctor to doctor hoping to find an answer. So I'm also the guy that these families reach out to. And there's the consultant side where I see these cases that are really troubling. But then as the general pediatrician, there's one thing that is coming to light, and there's a group at Stanford actually looking at this, and that's actually the manifestation of tongue ties. We don't really, as a outward community, we don't look at things like this, but if you go talk to the people who live in this world, and we're not talking the hokey person in their clinic that has no degrees. We're talking like Stanford researchers. The Stanford researchers are saying that no, there's actually an epidemic of tongue ties, and the rates of ankylosglossia, the rates of tongue ties has gone up exponentially in a way that we never saw before. And I mean, I'm definitely smarter at identifying things like this than before, but I can say just even in the last few years, like before, maybe 1 out of every 5 kids, maybe 1 out of every 10 kids would be born, and they would have feeding issues and latching issues and trouble feeding, and those things which are part of what's indicative of a tongue tie. And I mean, I hate to say this, I'd say a quarter of the kids that I see have these same issues. And ultimately, when we send them to someone who's highly trained, pretty much all of these kids are having tongue ties. And it's not just because we're shooting at, doing procedures. I use people who are actually very conservative. So a lot of times they're like, nope, go home, you don't have it. But these very conservative people are actually saying that no, these kids are having tongue ties, which is why they're having trouble feeding, and they're having trouble latching, and they're colicky, and they won't sleep, and there's all of this irritability. And when you start asking around, like you see like, oh my God, like, no, there are a lot of these babies that have that. And, these are, in a way, the silent epidemics. I hate to use this word because I don't believe in the fear-based model of thinking, and that's not how I or our family lives. But there are these silent epidemics that's unfolding underneath our noses, and we are simply just not ignoring them, but we don't know to even recognize that these things are there so much as they're happening, and so much that their rates have increased in these ways.
Well, it's interesting that you use the word epidemic, because I use it all the time in reference to chronic disease like diabetes and heart disease and autoimmune disorders. We see infertility now rising up to these increased numbers that are quite scary. But and again, my family, we don't want to be fear-based, but I mean, sometimes facts are just facts. Numbers are just numbers, right? And So just go back a little bit and explain, because I know a lot of our audience and our listeners, are parents that are about to have babies, they have young kids, but explain what tongue tie is, what causes it, potentially the theories behind it, and then how it's being managed or
Yeah.
treated.
Yeah, so I mean, a very easy way to look at tongue tie is, imagine you're sitting on a chair and your hands are shackled to the chair. And you try to lift up your arms, but you can't because you're cuffed, you're shackled to the chair, and you keep trying, and ultimately you can't. So actually are unable to move your arms or limbs physically. The tongue should easily be able to be stuck out of the mouth, and it should be able to easily be elevated. Where if the mouth is open, so for those of you listening, imagine you open your mouth, and you should be able to, with your mouth fully open, have the tip of your tongue touch all the way to the roof of your mouth. When you look, there are a significant number of individuals, kids and adults, that actually are unable to do that. And how this translates into real life is, when you look at what the tongue does so much in our mouth. Babies need the tongue to suckle. It's part of what creates that movement in the mouth that then creates nice suction and ultimately allows them to have a very effective latch. So some moms will say, like, God, my baby just won't latch. And either they get on the breast, but their suckling is not very good. So sometimes their latch is okay, but they're just not getting much milk. And it's not because mom's supply is bad, it's because baby doesn't know how to pull that milk out. So you get all of these weird manifestations early on. And this is despite doing lactation consultation and doing all of this hard work. The baby just doesn't feed very well. And sometimes we have moms who have really good milk supplies. So the milk is just pouring out. But then around 2 or 3 months, all of a sudden, like, the baby stops losing weight. Why? Because baby just had milk gushing down their mouth. And now all of a sudden, when they have to work for it, they don't know how. So these are subtle early signs. A lot of these babies are very colicky, we call them. So they can't ever go into a deep relaxation state. Babies normally, they feed, they cry for a second, they get satiated, they knock out, sleep for 3 or 4 hours, get up and do it again, right? These babies are in this constant state of hypervigilance, fight, flight. And one of that is because they're never transferring milk efficiently, so they don't get that milk coma. If you get into the interesting worlds of osteopathy and craniosacral and some of these other worlds, what you find is that constant pulling of the tongue, because the tongue is a muscle, right? And that muscle keeps pulling on the back of the neck. And there's this fascia, we call it, which is this elastic tissue that basically, when it's there, when there's a tongue tie, that shackling is now this muscle pulling on these shackles, and these shackles actually happen to be connected to the back of our neck. So a lot of these babies, from the best way we understand, not that we've gone and interviewed 2-week-olds and said, hey baby, what are you feeling there? Are you having neck pain? Babies can't really answer that. But one of the things that's really interesting is, in these babies, there's this constellation of issues. So feeding issues, poor latch, and then also just this colicky baby that you can't console. A lot of times what parents find is, when the tongue is released by someone that knows what they're doing, and then all of a sudden the baby has an adjustment by a chiropractic, craniosacral person, osteopath, whomever, all of a sudden a week or 2 later, they're like, oh my God, my colicky baby is now sleeping. Oh my God, I have a different baby. Why? Because they were able to finally feed more efficiently. And also just that tension that was in their back of their neck is gone. And these are little things that we don't pay attention to. We just say, well, some babies are colicky, right? Some babies just cry for 4 hours every day, and it's just kind of what is, right? And I think part of why I love doing what I'm doing, and why I actually got drawn into this world of integrative medicine, is I did not find it satisfactory to just say, well, things just happen. Some babies just cry for 4 hours a day. We don't know why, but they just do. Some babies have horrible eczema and we just cover their skin, but it's just what happens. Nothing just happens. There is no thing that is just coincidental. There is no thing that just coincidentally happenstance occurs. Everything has a reason. Everything that shows up in a child happens because of something. Now, sometimes some things aren't worth asking because the energy you spend trying to look for it, the parents are like, should I be worried about this? I'm like, no, running down this rabbit hole is not worth your time and energy. And at the end of the day, it won't matter. But your kid crying for 4 or 5 hours for the first 3 months of their life probably matters, right? Like it's not a fun scenario. So it's looking at these things. And, you talk so much, about the impact of food and nutrition and all of these things, right? Well, think about it. What happens in a scenario where the child, the baby, has their tongue attached to the base of their mouth so that they don't know how to use their tongue? And then let's say that kid grows up and now they're the 1 or 2 year old. What do you think happens to their ability to eat? What?
It's tough. I mean, your tongue is there to taste and sense the world. And, we know from neuroscience studies that we can even smell through our tongue when your nose isn't working and vice versa. And so, yeah, if your tongue is not able to do the, tens of thousands of functions that it's designed to do, I mean, are you going to appreciate the complexity of those flavors of foods? Probably not, I'm assuming,
Probably
right?
not.
Yeah.
And think about mastication. So chewing is a horribly complex process. We take for granted because, most of us do it without thinking, right? The same way we can walk, the same way we talk, the same way we do all of these very complicated things is also the same way we look at chewing. Chewing is a very complicated motor task. And when the tongue is actually disabled, it's attached, chewing actually becomes very difficult. So a lot of times what we see is this very specific pattern. Kids don't breastfeed. They're super colicky early on. Newborn periods are a mess. Half these kids end up on formula because the moms just give up. And then when they're 3, all of a sudden you've got these extreme picky eaters. So mac and cheese, chicken nuggets, pizza plus or minus, and one other food. And, we just say, well, that's kind of what happens. Some kids are just picky eaters. Some kids just don't eat vegetables. Some kids don't do this. But then when you put their history together, all of a sudden it's like, oh, Jesus, like this kid never knew how to eat. And what we're seeing as the 3-year-old version of the baby is actually the same human being with the same limitations and the same difficulty that is now showing itself in a different way. And you've had some really impressive people on your podcast, so I'm sure you guys have gotten into, conversations about what happens when all you eat is gluten, dairy. And it's not to shame gluten or dairy, but what happens when there isn't one vegetable in the child's diet? What happens when there's not one clean protein and it's just sugar and fat, sugar and fat, sugar and fat? It disrupts the entire system, right?
Well, this is the part that I hear this from a lot of parents because they ask me, like, how do you get your kids to eat vegetables? Like all 3 of my girls, they work in our restaurants. We have full plant-based whole food restaurants, and they get in there and they can, like you say, make a soup, and they'll make a soup with 15 ingredients, and they know how to season it and flavor it. And and my youngest, she's 10, and for sure she's we'll call her the picky eater, but she will eat almost anything on any given day. She might not feel like eating it every single day. So but part of that is that, they were not tongue tied when they were babies. They latched great. I consider myself a very lucky mom, in the sense that, I didn't have these things happening. And so they got to experience and love the complexity of all of the different foods we were bringing to the house. But I do have a lot of parents that ask me, they're like, how do I get my kids to eat this way? They will only eat mac and cheese. And now hearing this piece, because in all the discussions I've had with other physicians, and none of them have really brought up this tongue-tied piece, which you do remind me of an ex that I had as an adult who was tongue-tied as well. And a brilliant soul, amazing, but again with him as well, it makes me think about his relationship to food, and it makes me wonder if for the previous 40 years, if that was the battle that he was having. So I want to go back to one piece before I also, the other piece I'm thinking about is their ability to even just communicate and speak as well, because obviously your tongue is so needed in
Yeah.
that. But going back, you did mention, osteopathy, chiropractic care. There's a number of different practices, which even as I mentioned chiropractic care, I know there's people listening who are saying like, I've never been to a chiropractor. I don't even know what that is. So how does that help with kids that are tongue-tied, for the, members out there that are listening who might not know that there are perhaps non-surgical treatments for tongue-tied kids?
Yeah. So, I mean, if you have a true tongue tie, you can't therapy your way out of it. You
Okay.
can do things to release the tension in the tissue. So look at it like this. Heavens forbid someone gets in a car accident, right? And someone plows into your car, let's say. Imagine all that force coming into the car, which crumples the back of the car. That force goes into our body, right? And a lot of times we don't really consider what these forces do to the body itself. I mean, I recall, God, thank God this was many years ago. It was over 10 years ago. We were in a really bad car accident, and within 12 hours, 24 hours, like my entire body hurt, my neck, my back, everything was
Jesus,
just
right
a
up.
hot mess. And I literally couldn't move. Like literally, I couldn't turn my neck. Like I couldn't, turn my back, and it was just constant pain. Now, when you look at the body, what holds the body together? It's not the muscles. The muscles move the body,
There's
but the
fascia.
bones and everything, they're ultimately connected to each other with this saran wrap kind of elastic tissue. It's called fascia. Fascia is this saran wrap that basically it keeps all of our body together. Without fascia, we would be one big blob with some bones and muscles all like in a blob, literally. But our structure is held together by these elastic bands. And these elastic bands, fortunately or unfortunately, are very forgiving. So if let's say you get socked in the face, or you're playing football and someone tackles you, that force goes into the body and we kind of roll with that force, but we forget that that force went into the body and now went into the fascia and actually distorted the fascia in a way where now we call it torsion, so it's basically like a torque. There's a spin that goes into it. There's a twist that goes into it, is maybe the best way to look at it. And sometimes that twist releases on its own, and sometimes it doesn't. In the case of that bad car accident we had a while ago, like those twists went into my body and they were just there. And I basically, reached out to one of my friends and I was like, hey, buddy, can you help me, please? I'm a hot mess. And he's like, yeah, sure, come on in. And imagine a very highly capable form of massage is really the best way to look at this. Chiropractors kind of pop joints. I'm sure we've all, heard or seen or had that done. And, sometimes it's great, but what these folks do, the craniosacral therapists, and sometimes chiropractors do this, osteopaths do this, they're not popping anything per se. What they're doing is they're actually using small amounts of force, and it almost looks like complete voodoo when you look at it, but they're using small amounts of force to actually unwind that tension, that twist within the tissue. And it's crazy when they do it, like within one session after an hour and a half of work, like the next day I woke up and it's as if I had no pain, no aches, no anything. It was amazing. And I've seen this with hundreds of my patients. So what these folks can do is basically, if the tongue, let's say, is pulling on the fascia that's in the back of the neck, and these little babies, we presume, we don't know, but we presume that they have this constant achiness to them. A lot of times these people can go in there and release the tension that is coming from that tongue constantly pulling. Things work even better when you actually release the tongue, so the tongue itself now has normal mobility, so it's not shackled down, and then you go and release whatever is there from the tongue tie and everything, and then you almost get like this double benefit, which then usually results in a happy kid.
That's amazing. So would that release happen through a surgery then?
The tongue tie, yeah,
Yeah.
usually surgery is required.
Yeah, and it's reminding me of a friend of mine, and her son was born 3 weeks before my daughter, and he would projectile vomit all the
Mm.
time, and he would arch his back constantly, and he was colicky, he was all of these wonderful things that make it so hard to know how to, lovingly parent the child, like this child who's screaming nonstop. And that's exactly what she did. She took him to a chiropractor who knew about active release and like really had studied extensively about releasing fascia, and also to a cranial sacral therapist. And it was magical to watch
Mm,
his
mm, mm.
treatment, because his whole body, just like you said, how it gets torqued into a position. Well, what they figured is through the birth as well, is that he had been
Mm.
stuck in one position for so long in the birth canal, because she was in a 36-hour labor. And so all the muscles and everything had seized, and probably the fascia as well. And so when the practitioner released this, he actually went into the same position that he was in the birth canal, and then unwound out of that. And then after that, the
Wow.
projectile vomiting stopped, the colicky nature stopped the screaming, the crying. He was able to latch, he was able to feed. And so it is really important, and we had talked about this just before I hit record, was that, in so many cases we have to keep looking, because there's going to be a solution. And we're talking about the book that's on my shelf, which is also on your shelf, which is all about mold and other irritants in our environment. But we can, it's to remind people, don't stop looking for a solution, don't accept certain things to be just the way it's going to be, and that you just have to battle your way through it, when there's so many incredible competent people out there. And even if your one physician is saying that's just normal, it's okay, give the baby Tylenol, which I've heard so many physicians tell my clients and their babies to do for their babies, when that's there's other solutions
Yeah.
out there.
Yeah.
And you've just mentioned, three incredible solutions, with is a very savvy chiropractor, craniosacral therapist, or and you also talked about an osteopath as well.
Yeah.
So yeah, no, I thank you for sharing that. There is I'm really curious, um just wanting to get into, how did you get into all of this? Because you were trained, just as every other medical doctor was trained, every other physician was trained. But how did you get into integrative healthcare and integrative medicine?
I think to answer that, as you asked that, I had a flashback. So I was, I think, 6 years old,
Oh wow, we're going
somewhere
back.
around 6 to 8 years of age. And my parents came into the living room and they saw me with a screwdriver unscrewing the back of the TV. And this is back in the days when we had the cathode ray, with like tens of thousands of volts, behind the TV. And like, there I am, like unscrewing it. They're like, what are you doing? I'm like, I want to see how it works. It's like, to me, it was like logical. Like, why would you not want to know like how this like picture appears, right? And I think that curiosity never really left me, and to this day, it's always like, I want to see how it works, like what is going on deep in this child's system that is causing them to be that way. And I think, well, to first kind of preface what I'm going to say, I think a lot of times in medicine we encourage physicians to let go of their curiosity.
Mm-hmm.
A lot of times physicians are told, well, this is how things are. This is the right answer. This is the standard of care. And because this is the standard of care, this is the end of the line. I look at things as we should all follow the standard of care, because that's kind of the minimum bar that everyone should set for themselves. But the standard of care is kind of, in certain times, the standard of care is awesome because it provides safety. It makes sure things aren't missed. It makes sure that, some things don't get screwed up. So I'm not questioning the standard of care. But what I am saying is, a lot of times what I hear from, physicians that I know as friends, that they've kind of resigned to say, well, this is just how things are. this is just what is. And this is just what we have to do. And to me, it's like, well, gosh, no, like to me, that's just the start. And I think part of why I find myself really fortunate, and every day I count my blessings to be able to do what I do, is, to me, my practice is like, one, I get to deal with fantastic people whom I love interacting with, and I love, just being a part of their lives, and they appreciate me having a part of their lives. But more so, we get to have fun. We just ask these weird questions, and like, kids show up with something and I'll tell them like, hey, we could do this, we could do this, we could do this, we could do nothing. What do you want to do? And they're like, let's do it. I'm like, cool. And then we just run down these rabbit holes. And it has been my patience. My patients have been really my greatest teachers. They have been the ones that have opened my eyes. Sometimes they bring me information. They're like, hey, what do you think about this? I'm like, damn, I didn't know that even existed. Let me check it out. And then, sure enough, like that opens my eyes. And then I start looking into other things. And then this cascade of events unfold. But to go back to your question of how did I end up where I am? So, that curiosity, and I think, for me, science is an area that my brain tends to be well geared for. Um, I knew early on that I liked science, and, I liked helping people. And therefore I thought, well, God, medicine is kind of a good, niche for me because it kind of does both. And when I started school, I found myself really disheartened because, everything was kind of like a protocol, right? You memorize this, you do this, and then you do this. And it was just basically you're memorizing complex protocols. And I could feel that curiosity being squashed out of me. And I got to a point where I remember it was my third year of medical school. I had decided at the time to actually drop out of medicine and go into healthcare administration. So I had already like literally found an MBA program. I was already talking to them to apply for it. And then pediatrics showed up, and I had no idea I liked kids at all. And I basically did my first rotation, and it was the weirdest thing ever. It was almost like you see those movies where there's like all of a sudden rainbows in the backdrop, and like there's a pony running around, and there's like this fairy music. Usually people are on psychedelics. For me, it was like there was no drugs involved. It was just being around kids was the coolest thing on the face of the planet. And I was just like, damn, you kids are cool. I like you. And they're like, we kind of like you too. So it was like this match made in heaven. And Jesus, that was 2002. So it's been a minute since I graduated school, and I fell in love with the kids, and they're actually part of what kept me in the practice of medicine. And then I decided to change gears and ended up doing a pediatric residency. And it was in the pediatric residency that my curiosity started coming back. And, I was the weird resident that was asking all of these strange questions of like, well, what about this? What about that? Why is this way? Why is that way? And my attendings would just kind of humor me, and they're like, there he goes again, asking those silly questions, and I remember there was two cases in particular that I will never forget. One of them was this, adolescent, sweet Latino guy who was playing football and basically took a slide, had a tiny little cut on his knee, came into the ER later that evening because his knee had gotten red. And within 24 hours, this poor kid died. And basically the bacteria had gotten into his knee, somehow managed to get up his leg into his abdomen and just spread everywhere and took his life. And, all of us were just like, what in God's good earth just happened? And the docs were just like, well, he just had this bacterial infection and it killed him. I'm like, wait a second, how many times have I gotten the skin cut and I didn't die? Like my knee didn't blow up. Like, what are you talking about? And I remember this other kid, this sweet, also probably 12 to 14-year-old boy who had colitis, and his intestines were really inflamed. and he came into the hospital because it was getting really bad. We did some IV drips with steroids and medications. He got better. He left, but then a week later he came back because it was even worse. And I vividly remember, like, our team got together, the entire senior staff, all the doctors, we had a meeting, and they're like, well, he's failed this medication, he's failed this medication, he's failed this medication. So therefore we have to consult surgery for them to take out his colon. Literally, it was like, because these medications have failed, we have no other options. And because we have no other options, the next option is surgery. And like that, those two cases happened within a relatively short period of time, like of a few months, and they both hit me like Mack trucks. And it's almost like I got swiped into an alternate reality where I was just like, wait, what? Like, how can we be doing this? Like, how can we just say, well, medications don't work, so let's just cut this kid's colon out for the rest of his life and leave him without a colon? And it was in that moment that I really just started saying, well, there has to be another way. Like, there has to be another way to look at these things. Like, these can't be the only answers. And that then led me to talked to some of my mentors who then suggested I look at, doing some courses in holistic medicine. And, I fell in love with that. And that was, I don't know, 15 years ago. And I've done, an absurd amount of training since then. But one of the things that I've realized over time is a lot of times, whatever model that we're in, whether you're talking to the chiropractor or the Chinese practitioner or the conventional doctor or whomever, everyone for some reason thinks that their model is the best model to treat whatever disease, right? You go to the acupuncturist and you say, hey, I got, chronic diarrhea and whatever. They will say, well, I will give you this Chinese herb and needle this point, and I will try to make you better. Rather than saying, well, you may have mold, you may have this, maybe you have a food intolerance, maybe you've got, imbalances in your gut bacteria. And part of what I've seen over time is that as I've hopped around from one group to another, and it's really been my patients, I've had cases where whatever model that I trained in, I got like obsessed with functional medicine, but then I had a bunch of people that didn't get better. And the gut treatments and the diet treatments and all of these elimination diets and everything just didn't work for some patients. So I said, well, gosh, there has to be another way. And it was that same question and that same thing. And I hope that, if nothing else, this conversation we're having will allow people to step back and say, like, God, it'd be kind of cool if I can have the same playfulness and the same curiosity in my own life. And, as I encounter these weird cases that make no sense, I'll just say, well, gosh, maybe there's a reason for this. I don't know what the hell that reason is, but maybe there's a reason. And I think one of the practices that I've developed is by allowing myself to be in that uncertain space where I have no idea what the hell the answer is, but I know there's an answer somewhere, that I allow myself to be open to receiving answers that I don't know. And sure enough, I mean, sometimes it takes 6 months, but sure enough, suddenly an answer out of the blue from an email or a patient or whatever comes. And I'm like, oh, darn, whoa, there it is. Cool. I never knew. And, after doing that for 15 years of like, oh, I never knew, it creates more and more diversity and more openness to looking at things. And that's at the end of the day, how we can really help people, I see at least.
Well, it's such an interesting place to be because we're not taught that in any profession that we go into. We're not taught to be vulnerable. You're not taught to say, I don't know, because you're in that profession to figure it out, to be a specialist in that area. And that's the part where, when it comes to the human body and human health, it's, everybody's an individual. Everybody lives in a complex world of so many environmental, stressors, both positive and negative. So how can you even in a few appointments, whether they're 7.5 minutes, typical, physician, patient appointment, or even if you're spending an hour and a half with them, it can sometimes take a lot more time. Like you said, it could take 6 months to figure it out, but why not let it take 6 months to figure it out when so many of these people, I know so many of my clients that come to me, they've been battling their illness for 20 years and nobody's been able to figure it out. And so we take that time, but to be, and I love that. There's two pieces. Number one, to be curious. Like, we have to start encouraging everyone, no matter what the profession, to remain curious, because we only know what we know right now. And we know from history that knowledge shifts and changes. And sometimes it's literally wiping out the old and coming in with the new. And other times it's just building upon it. And so we don't know what that next, aha moment is going to, where it's going to come from or what it's going to look like. And then the other part is that vulnerability, right? Everybody's talking about vulnerability. Brene Brown, the queen of vulnerability. But to actually practice it and actually be okay with being vulnerable, I think is still something that we all need to learn how to do. And as well, bring that into medicine, especially to allow physicians to say, you know what, I don't know. And where can I look for answers? But there's a part about the name of your business that I love, of your practice, Wholistic Kids, because I am guilty of when people come to me, I'll be like, food is the answer, like let's at least try that. Because most of my clients have not tried food. They're like, that's the last thing that they're going to really change. They're going to try everything else first. But one of the practices that I teach all of my clients is to build a whole health team. And it's to look at your condition and say, what are all the possible modalities of treatment that you could look at? Surgery, chemo, radiation, maybe it's, acupuncture, like you said, traditional Chinese medicine, Ayurvedic medicine, diet, maybe it's massage or sleep therapy, or, we paint this whole beautiful picture. And then I encourage my clients to look at the whole health team and imagine that they're all there to serve you. Who do you go to first? And allow them to use their intuition. And what usually happens is they're like, well, I don't know what chiropractic care is, but 10 people have told me that that's what I need. Right. And then they're all of a sudden being willing to like venture into these new places to find those answers. And definitely for some people, I get the expense around that. And the time. And we talked about this earlier, like, how do we make this standard of care accessible to everybody? And I want to get into that with you.
Yeah.
But I just want to say, thank you for being curious and thank you for being vulnerable, because it's ultimately, it's who you are, but it's what allows you to help your patients come up with solutions to their health conditions. So before we go into this next phase of your life that you're in with developing this other arm of your business, Holistic Minds, I want to first just go back into even before you got into this. And can we talk a little bit about how, you had to flee Iran when you first came to North America with your family? And can we talk a little bit about that? I'm really curious about, how old were you when that happened?
I was 6.
6. And do you remember that?
I do.
Do you remember living in Iran as well?
I have certain flashbacks, certain flashbacks of like our initial home, like my grandparents' home. They had like this big pond, and as a kid, like I like that pond was our pool, and like every summer we'd be there. So I have a little flashbacks of that. I think one of the memories that will never leave me is we ended up getting visas to leave Iran, and my dad didn't. And I remember very vividly that we were getting on the plane in Iran. They had the stairs that go up to the plane. So there weren't like these, terminals that we have here. And I remember going up on those stairs with my mom and looking at my dad being left in the country. And this little part of me saying like, am I going to see him again? And I was 6. And it turns out that it was a harrowing year and a half before we could see him again, because he tried to escape illegally twice or 3 times through Turkey, got imprisoned twice, was in prison for, I think, 2 months one time. And we would go, it's not like you had cell phone coverage back then, right? It's not like you can send us a text message like, hey guys, I'm on the border of Turkey. So there were literally periods of 3 to 4 or 5 months where we would not hear from him at all. And like as kids, I was only 6, my brother was 3.5, and we were at my grandmother's house, so we were having pool parties, and like they were doing a lot to keep us distracted. I can't even begin to imagine what things were like for my mom and dad. I mean, I've talked to them and I know, but I think, being young parents and going through that, like, God, a living nightmare. And, that this is the reality to this day for a lot of people, right? That there are a lot of folks that have a experience that's not too much unlike what we went through. So it was a bit of a struggle for us to come. We actually were in Italy as an asylum kind of refugee, I think, for 4 months, where it was basically my mom and the two of us. We were staying in a hotel for that period of time until we actually got permission to come to the States. So it was a bit of a journey. It was a bit of a journey.
Yeah, and the reason I asked that question, just wanting to go back, is I'm just curious about how that influences you and has influenced you as a physician, and especially being in California. And, with the work I do, we see that a lot of, people of color, Indigenous, First Nation, Aboriginal peoples, they experience chronic disease rates and health issues at much higher rates than, white or, settler individuals. And so in California, where your practice is, are you seeing predominantly, white families, wealthy families, immigrant families, people of color? What's the demographic of the people that you're treating?
So, I'm lucky in that sense because we started off with a very nice, diverse practice. And back then, I was charging a very nominal fee to have people come in. And, for those folks that came in early on, I've never changed their rates. Over time, what I have found is, because what I do takes so much time, like, I'm lucky if on a good day I can see maybe 10 to 12 people. And when I have my complex consults, it grinds me down to like 6 people a day. And, one of the things that I have looked at is, well, how do I do what I do and make it accessible to more people? And I consider myself very, very fortunate because I've had the opportunity to go train with some very smart people, and this has been over the last decade and a half. And some of these trainings didn't come for free, whether it was time, and some of them cost a good bit of money, and there was a lot of time that went into it. But one of the fundamental issues that I see is, to really make a difference in the delivery of holistic and integrative medicine, technology has to become a part of it.
Yeah.
I like I mentioned early on, a good part of what I do is deal with very complex cases where, the kid has had X number of years of totally unexplainable symptoms and issues. No one knows what the heck is going on. And before people come to see me, they fill out a 12-page questionnaire that I take, sometimes half an hour to go through. We talk for an hour, and then I spend another half an hour, 45 minutes kind of devising a plan to help them. And then we keep this cycle going until we kind of get to the bottom. That much time investment in of itself makes this model of medicine very inaccessible. And as I've really become clear about this, and I've also become clear in terms of the scope of the problems that are there. So going back to what we initially talked about, I don't know if you know, but somewhere around 15 to 20% of kids in this country are diagnosed with some kind of mental health problem, which is staggering, right? I mean, it's just mind blowing. Up to 5% of kids are diagnosed with a conduct disorder, which is basically kids that can't regulate themselves. They're aggressive, they're highly impulsive, they're destructive, they're failing out of school, like their lives are falling apart. 5% of kids in this country have a conduct disorder. Upwards of 10% of kids are diagnosed with ADHD, and the statistics are similar with anxiety. When you look at these numbers, it's just like, oh my goodness, like it's a little bit overwhelming to look at this. And the part that really really irks me, and one of the things that I think really makes this personal for me is, as a kid, I had over the top anxiety. There were adolescent periods where the depression was completely taking over me. So part of why I've come to really be drawn to helping these kids over, other kids with autoimmune diseases and everything, is really because I see a lot of myself in the kids I help. But when I look at some of these kids who are really suffering and they're really in pain and they can't control themselves, they can't manage themselves, I'm like, holy Jesus, if this child didn't get the help they need, if the families did not know how to find someone to help that child become healthy again, and the family structure in that home fell apart in any way, these are the kids that fall apart down the road.
Yeah.
These are the kids that when they fall apart, they end up in prison. They end up doing all kinds of really awful things. Like I look at some of these kids and I adore these children. They are the most beautiful little spirits you can ever imagine. There's so much light inside of them that it's just, you can see like there's so much goodness inside of them. But these kids are in so much pain. Their systems are in such a chaotic mess that what shows up on the outside is just this derangement that is inexplicable. And when I look at this and I say, like, God, like, if we don't do something to help these kids, they are going to fall apart, and they do. And the statistics show that, if a kid has ADHD, really bad ADHD, their likelihood of failing out of school is 200 to 300% higher than the kids that don't. The risk of incarceration is at least double. And you look at these statistics, and then you get to a point where you're like, oh my God, like, we have, like, at least for me, it's like, I have to do something about this. We have to make a change, and this has to happen because we can't allow this kind of suffering to continue when there are answers to help resolve it. And this combination of things is what ultimately led me to what you were hinting at, which is Holistic Minds.
Yeah.
And Holistic Minds is basically the creation of an intelligent healthcare information portal that allows families, by answering very precise questions, to understand why their child is suffering and behaving the way they do. And by precise questions, I mean, like, if your child wakes up in the mornings, do they get grumpy and do they get dark circles under their eyes? Does your child have this kind, like, does your child overthink something to the point where once that event happens to them, they get anxious? Like, weird questions that no one would ever think of asking, but I've learned how to ask those questions just because of the mentors that I've had. And these questions then help us start formulating a picture of what's going on within that child. And then through that, we're able to give families guidance in terms of where they need to go. And it's kind of what you touched on. Like, if you don't know where to turn, how do you know what answers to go find? If you don't even know a chiropractor can help you with your back pain, how do you know to even go find that person? But if we created a system where, by answering the questions, the system could say, hey, these are things you may want to explore with your physician, whether it's going to see a chiropractor, or maybe your kid has a tongue tie and you need to go talk to the ENT, or X, Y, or Z reasons. We start really changing the paradigm of integrative healthcare. And instead of it being something that is way too costly and ultimately way too limited, it becomes something that becomes accessible to everyone.
Yeah, and I love that, because like you were saying, now there's so many practitioners who have studied integrative medicine and functional medicine, and we have all of these very qualified people doing this, but it is very inaccessible to so many families. And not just because of the price, but even just letting them know that this exists, right? And also, when you go in, and it's hard to explain your entire life story in one session to somebody, but if you can give them these tools first where they can start to make the connections themselves, then when they show, when they present for the appointment or the meeting, then at least there's that launching pad to work from, which I think is always so helpful because, I'm reading a book or my daughter's reading the book to me right now, but it's Judy Moody, MD. And, it's a kid's book and it's this little girl and she's so fascinated by the human body and anatomy. And MD doesn't stand for medical doctor, it stands for medical detective, so she's this detective. And what she's finding out is that medical doctors have to be detectives, and you can't solve a case in 5 minutes. Like, it takes time. And if you can get the families to answer a lot of these questions and to get curious about it, and to be willing to talk about these things that they normally don't get asked or aren't willing to talk about. Even, for example, I know one question that I ask every single one of my clients is, how do you poop? How's your poop looking? Is it diarrhea? Is it constipation? Like, let's talk about poop. And within 2 seconds, they're so comfortable talking about it. But when they often go to their physician hasn't asked them about their poop or their sleep or their, do they drink water or what kind of food did they eat? And some of those like really basic questions are often the first to start with. Or does the person like to be touched? Like, that's a question. Are they sensitive to the clothes that they're wearing? And, and I'm sure you have a whole host of questions. So what would this look like then for families? Because now, of course, because COVID has hit, we are in the world of information overload even prior to COVID, but now digital courses and digital technology. And, how will this look and what will that look like for families? Like, how will they be able to access this? And how will they participate?
I love what you brought up. And I think information overload is a huge and fundamental problem with where things are today, right? You're getting bombarded with like, hey, take this course and you'll figure out your child's or your own health issues. Like, do this and everything will be better. Take this supplement and you'll be fixed, and people are just pumping money out on things that are just popping up for them. Except when you apply a good tool in the wrong circumstance, you get a really poor outcome, right?
Yeah.
Chiropractic care, when applied for something that has nothing to do with the structure of the body, does nothing. The chiropractor could be amazing and they may have healed, thousands of people, but when the wrong treatment is applied in the wrong setting, or the wrong supplement or the wrong diet is applied in the wrong setting, you get sometimes an adverse effect, sometimes you get no effect. And this is one of the fundamental issues that keeps people stuck, right? And it keeps doctors stuck too, because a lot of times, unless you take an hour and a half to piece through every single minute detail of what is going on in the child's life, and most people don't have the time, ability, or even the training to go through that, we get lost. And I sometimes see that even in our integrative medicine world, where these docs just do these big shotgun approaches and they do every test under the sun, hoping that they catch what's going on, rather than trying to piece into the details of what is there. So what the system does is, because over time, I've found that every single issue for the most part has a pattern, like the tongue ties that we talked about. Tongue ties have a very precise pattern in how they present. Kids typically have trouble breastfeeding early on when they're 1 or 2 years of age. So, going back to what you were talking about with the picky eaters, they're the picky eaters that were doing totally fine. And then at the age of 3, when their egos kicked in, they're like, you know what, mom, I don't feel like eating these food. Tough luck. You're not going to make me. But when they were 1 or 2, they were fine. They didn't know any better. So whatever vegetable mom gave them, if you're carnivores, you give the kids pieces of steak, they'll eat it. They'll eat pieces of chicken. They ate everything until they decided not to. Then there were those other kids, they didn't breastfeed. When they were 1 or 2 years of age, they were spitting most foods out. They would choke and gag. They would have feeding problems, eating problems. And then all of a sudden, they're now the 5-year-old that eats 4 foods and has a host of other issues. Each thing has a very precise pattern. Yes. Kids who are exposed to mold, they have a very specific blueprint about them. It's almost like you can sniff it out once you've seen enough of them. Kids with the structural issues, with the tension coming from birth that you talked about, they have a precise pattern. Each presentation has a very precise pattern once you've seen enough of them. And in the case of these kids with behavioral issues, because I've seen so many of these kids, I've kind of mapped out all of the different kind of issues that they have and how it looks. So part of what we're doing through asking these very weird, and half the questions that people look at, they're like, why in God's good earth are they asking this super weird question? That weird question actually is us probing into one specific area of one specific imbalance to say, is this thing there or not? And through that, what we're doing is basically mapping out how all of these different issues are coming together. And then through the system saying, well, these questions were positive, which means this imbalance is there. And this imbalance then means this thing is there. And through that, we actually create basically a little map of what's going on. We don't diagnose, we're not a medical provider, and we're not meant to be a medical provider. We're an educational healthcare portal that is there to help connect families alongside their doctors with precisely the right information they need to be looking at to have that breakthrough in terms of healthcare. So if, for instance, there's a tongue tie, by the time they've answered the question, the system may say, you know what, you may want to talk to your pediatrician about having your kid checked for a tongue tie. And we have 2 or 3 videos from the country's top experts talking about it, so they can look and say, oh, Jesus, yeah, that's my kid. Or, God, wow, yeah, we've gone camping, in the middle of the East Coast, and yeah, my kid did have this funky rash, and oh yeah, he did have a fever, and shortly after that fever is when he fell apart. Well, gosh, maybe you should think about Lyme. Yeah. So it's asking the right questions to get the right answers to then go after exactly the right information. So whether you're seeing a specialist or talking to someone about a treatment or doing a diet or doing a supplement, everything is done specifically for a reason rather than us just blindly shooting darts hoping we hit something.
And this is like, I have shivers because I can think of, like 50 scenarios right now that's happened in our family where we could have used this. We were in Africa. I did another podcast on this. We were in Africa a few years ago, and my family came back with bilharzia, schistosomiasis. We swam in a lake with warning signs. But, with coming back and getting busy in our life and running our restaurants and our 3 kids, by the time we got sick with it, we had kind of forgotten all about it. But all the classic signs were there, like looking back in hindsight, but none of the doctors even thought to test us for it. Nobody asked us if we traveled. We forgot to mention that we had, but if we could have gone through something like this, I bet you schistosomiasis would have come up, boom, go get tested. And instead we ended up in oncology ward at Children's Hospital because there was a mass on my daughter's bladder. It was really just the parasite, the mama and all her eggs as a mass, but of course we're going down that route. And I just, I was fortunate because it was one of my daughters who said, but Mom, couldn't it be that parasite from Africa? And I was, boom, went back to the doctors. And, and I do recognize how hard it is for doctors to be able to be that detective in such a short period of time. And, and again, I can think of 50 other examples where, your system would have been so invaluable and would have saved, there was one point we went through 17 different doctors to figure out that my one daughter had meningitis, but she had been vaccinated, but one of the doctors are like, it can't be that because she's been vaccinated. Meanwhile, there's 5, 6, how many different strains of meningitis, but all the symptoms were there. And so one of the things that we have to remember too, is in addition to being curious, it's in addition to, being vulnerable as a physician, it's also to remember we're human. Physicians are human beings. And as much as they can see patterns, it takes time to do that. So having this additional technology to help them with that, I can see it being, and I can also see it, so I can see it being incredibly useful, but I can also see, what you're on here. Some people could also take it to the extreme, thinking that the technology in the end could be that AI tool that will just do everything in replace of physicians. And at the end of the day, we still need a physician who can touch the hand and feel if it's clammy, or who could notice if there's a sag in the, patient's eye, that you might not be able to detect unless you're truly using your eyes and looking
Yeah.
and observing, right? Those
Yeah.
those human observation skills. So it's really, really fascinating. So is there going to be is there a timeline around this? Like, when can I start using this, or when can
Well, we're hoping, we're feverishly building the system as we speak. We're actually about a year into it. In about 6 months, we should have our first kind of testable system that we can, we'll have our first kind of system that we're privately testing. And if there are families that would want to become part of our beta testers, they're more than welcome to reach out. But the public kind of debut is probably 6 to 9 months from now. And like the thing you talked about, like, we actually have 2 questions that ask, like, has your child ever gone swimming in a natural body of water? And it's because I've had multiple cases where, they had all kinds of weird issues, and they went down every single road, and it was the kid went swimming in some pond or lake in the middle of Nebraska or wherever, and sure enough, there was some kind of funky parasite that had been missed. So, like, the weird questions that, like, people would never think of asking, just because I've been at this long enough and I've been able to, work with some really smart people that are experts in their own area. And literally, it's like putting 15 of the smartest brains together in one system, and each person asking things from their angle and combining it. And one of the things that makes it really remarkable is when you think about what computers do best, they do pattern recognition way better than human beings, right? I
Exactly.
consider myself pretty good, but have me a little sleep deprived because our 1.5-year-old decided to wake up 2 times in the middle of the night. My brain is like half dead. So like, my good becomes below average. And on that day, like, God, I can miss details, even if I spend an hour and a half. And computers can really rocket that to the next level, which makes it super exciting. And it's not about replacing the physicians, because that human element that you touched on is incredible. And ultimately, we want physicians to be the final kind of check of, like, yeah, this makes sense, cool, or God, no, this is totally off the wrong track. And computers shouldn't be practicing medicine. Computers should be augmenting what's happening and ultimately making it easier for physicians to see all of the things clearly without having to spend 2 hours.
Yeah.
And that's what makes this so cool.
And it is very cool, because even as I'm thinking about it, there, I have many friends who are health practitioners in all different fields. And we've often sat around and said, and we did this 15, 20 years ago, saying, okay, we need an integrated medical center. But how would you even do that? Because you can't take that patient and have them go from room to room to room, or you can't have all, 12 practitioners in one room with you, do like that. That's just the feasibility of it. It couldn't work. You would only be able to help a handful of people. Whereas what your system is, it's like the Airbnb and Uber of, health, ultimately, to be able to try and like do that pattern recognition to ultimately come out with the best option for your patient. And it's not to say it's the final option, but if you could narrow it down to like a parasite, or if you can narrow it down to a mold toxicity, or for example, I mean, you yourself too have been tested for the MTHFR gene mutation. And is that correct? Did I get that right?
Yeah.
Yeah. And I have a gene mutation that's just 2 steps before the MTHFR gene mutation. So for myself, I do really, really well with eating well-cooked greens from the cruciferous family, but they have to be cooked. They can't be raw. I need like that folic acid. I need the B6. I need, I really do well with that. And when my body is entrenched with it, then all of a sudden, like, my body operates extremely, extremely well. But I didn't know that until I also went down that genetic route. it was a $400 test. And for some families, that's really, really expensive.
Yeah.
But I can also see how your system could help bring in the knowledge from, for example, genomics, or from endocrinology, or from, hematology, or in all of these different areas. And as well as all the other, I hate to call them alternative fields, but, let's call them, the chiropractic, Ayurvedic, traditional Chinese medicine. And then when you pull that together, all of a sudden, you're just so much more, you just have a richness that's
Yeah.
there that can help
Yeah.
you get to the solution faster.
Yeah. And
Can we talk a little, oh, did you want
go
to
ahead.
say
Go ahead.
that?
Mhm. No, I was just going to say that, when you really get into the human system, there's such a beautiful and extraordinary complexity. And as you go into that complexity, the further you go, then that's when the simplicity of things start showing up, because everything in the body is connected to everything. And, the MTHFR is just one small cog in this huge clock of mitochondria and organs and detox and gut and immune system and so forth. When you can see how all of these things, these systems dance with one another, and how they interact with one another, and how the gut microbes affect the brain, and how the brain affects the gut microbes, and mitochondria affect these systems, and you see all of those things as one whole, that's when really amazing change starts happening. And that's when, these cases that seem impossible to really unravel actually become very possible to decipher and heal, because it isn't just about, let me give one supplement to fix one thing. It's really about, how do you transform the entire health of that human being at a core deep level, at a cellular level, at a physiological level. And once you do that, it's almost like the system itself unlocks. And once that happens, there's just this vitality and vibrancy. And I think, going back to these kids, like, I love working with these kids. Like, there's nothing that I love more than working with these children, especially the ones who are really sick, because once we get to that point, and sometimes it takes a month, sometimes it takes 6 months, but once we get to that point where their vitality starts coming out and they start healing, the kid who was acting just completely off and aggressive, and we have families where they literally have to lock doors to keep one child from attacking the other, and then 4 months later, that child that was aggressive and couldn't regulate and was getting kicked out of school and was being labeled with all of these awful things, diagnoses, all of a sudden is this beautiful human being that is shining and just incredible. And that is the essence of who we are. We all have that light within us. And part of what drives me is to try to find that light within every child and take away the chaos that distorts it, to then allow them to heal and thrive. And I think once we get to that complex model of systems biology, this kind of core root medicine, that healing becomes possible for everyone.
Yeah, I love you. I can see you actually creating a program for physicians, by the way, not just for families and, with kids who have, different issues that, they need a medical detective behind, but I can see you creating a course for physicians, because you've touched on all of these key points that you need to be. And this last piece as well, it's about seeing. Physicians need to see that beautiful potential that exists within every human being, within every child. And, often, parents can come in frazzled and, my kid is out of control. And to have a physician, though, that can see your child, like really see them, for their potential, I think is just another quality that, again, like, I don't know if you can teach that to physicians, but to have that belief and that trust that we are all innately, wonderful and good, and, we can be healed. And having that hope there, I think, is really important. And I think it's a true hope. It's not a false hope. I think it's legitimate. And you remind me, when you were speaking too, about, there's an amazing family psychologist out of Australia named Kim John Payne. And I don't know if you've ever heard of him, but there's so many similarities between what you've said and his work that he's been doing for over 30 years, 30 or 40 years now in the field. And he has a wonderful book called Simplicity Parenting. And so when he gets families that comes to him, that my kids are bouncing off the wall, they're aggressive, they're, acting out, but like in ways that are like beyond just a kid being a kid, he just goes straight into the family with black garbage bags. And what he does is he goes to the kitchen and he takes all of those foods that have all of the food coloring and dyes and preservatives, and those go in the trash. Then he goes into their bedrooms and he takes all of those toys, all of the plastic toys that are off-gassing, all of the toys that are creating too much noise and too much stimulation, and puts them in the plastic bag. And the only thing the kids get are handkerchiefs and clothespins, right? Because it's amazing what kids can do with handkerchiefs and clothespins. And then, so he addresses the food, he addresses the noise in the house. So it's those chronic stimulants that for some kids, when they're too sensitive initially, it's too much for them to even have hardwood floors. So sometimes he just lays down carpets, which is counterintuitive, right? But it's so that the sounds aren't ricocheting. And then he looks at the other things that maybe the child is missing, right? So it's that quiet time, it's the having parents read to the kids. And so there was a part of me that, and I'll just wrap up that piece with saying that often what he says is that the parents come back in a week or two and they're like, we didn't have to give our kids any medications. In fact, the kids are now off their medications. And these kids are exhibiting no signs of ADD, ADHD, aggressive behavior. So I'm really curious too about some of the work that you do is, can it be that simple that what the child needs is just maybe time in nature? They just need to be kids and they need to let out their childishness and childish behaviors in ways that kids maybe 100 years ago would have done. And I'm curious about what role that plays in the work that you're doing with families.
I mean, absolutely. And I think too many kids these days don't have opportunities to be kids. And there's too much media, there's too much stimulation, there's too many processed foods, there are too many chemicals, there's too much sugar. So all of those things, without a doubt, can be a problem. And, one of the fundamentals I teach our families is like, if you're feeding your kid chemicals and, crap and sugar, like don't expect them to behave. And I make the analogy for families, if you give your kid sugar, you're basically tripping up their systems, and you might as well be giving them amphetamines. Like if you want your kid tweaking out, give them sugar. And a lot of times when I present it like that, they're like, oh, Jesus, like I had no idea that, this was having that kind of an effect. But I think that is kind of the foundational level, right? Those are the things that we want all families to be aware of. There are layers beyond that where families have done diet and they've done these things and are like, I have no idea what's going on with my kid. They are freaking out of their mind. And, like they say, my kid flips from Dr. Jekyll to Mr. Hyde, or Mr. Hyde to Dr. Jekyll, where all of a sudden my kid, who's lovely and kind and a good human being, is now just aggressive and can't manage themselves. And they're hurting me. They're hurting my other kid. And there's more of these kids than we can possibly imagine out there, like hundreds of thousands, if not millions. It's just, we're so distracted by our society, by all of these other things and all of the infighting and all of these, concerns, that we are not even beginning to understand really the epidemic of childhood behavioral and conduct disorders and mental health issues that are there. It's an epidemic. We're just not seeing it because we're too busy with all of these other things.
So what are you must have the theories as well as the science behind, the causes for this, and you did say it earlier in the podcast, this epidemic. So, I think about, the mass shootings that are happening at such, rampant, rates. And, what are some of your theories behind, or the things that you've actually seen directly, the cause behind this?
So typically when we see aggression, when there is extreme impulse control, when there is this kind of explosiveness to the human being. And I can only speak to the children. It's not like I treat adults. So in the children I take care of, when I see this explosive nature to them, where the kids literally just explode out of their own minds and they have these extreme explosive aggression bouts or whatever else, that is almost always an inflammatory response.
Mm-hmm.
And oftentimes to many a times, that inflammatory response is coming from Lyme, mold, strep, or some kind of a toxin or exposure that is tripping the immune system up in an incredible way. And now the NIH and Stanford and all kinds of different institutions are really paying attention to this. So if you look up PANDAS or PANS, like there's a whole body of information talking about this, where these kids' ability to regulate their nervous systems is completely off. Like they have these extreme bouts of OCD, they have extreme bouts of rituals, like everything about their neurological pattern is completely illogical. But that's different than other things. So I think in the case of these poor people who are doing really horrific things, I think if we were to look, we would probably find in their systems one of these big inflammatory triggers, presuming there was no horrible, childhood trauma or sexual abuse or so many of these god awful things that happens to some people that they just can't recover from.
Yeah, no, and I'm glad that you brought that up too, because, I recently read an article where a lot of psychologists are seeing, these teenagers and young adults who haven't had any of these significant traumas, like the rapes and the child abuse and the, growing up in a family of alcoholics or things like this, but they're still exhibiting the same post-traumatic stress behaviors and symptoms. And so, it's seeing these micro stressors, over long periods of time, like whether it's the Lyme or the mold or the strep. And it's the same thing with chronic conditions like diabetes and heart disease. And I mean, they're all inflammatory conditions. And you remind me as well of the book by the journalist, Brain on Fire. And you see her symptoms come out as being, paranoia and compulsion and then aggression. And then she ends up in a psychiatric ward. And it turns out she has inflammation in half of her brain, and it took and like you said, it comes back to being, it was a very simple test that was able to diagnose it, but it took a schwack of, some of the best neuroscientists who really couldn't come up with any other solution other than admit her to a psychiatric ward for potentially the rest of her life. And then it took one neuroscientist who said, no, actually, let's look and see if it's potentially inflammation. And sure enough, it was.
Mm-hmm.
And so what do we do? What do you do? Or what can the families do? And especially for other physicians that are hearing this and who might be understanding this for the first time, because everybody talks about inflammation, but can you explain that mechanism of action around the inflammation as it relates to these presentations of these symptoms?
I don't, at least in the studies that I have come across, I don't know if we truly understand all of the mechanisms through which inflammation causes aggression or some of these things. We know that inflammation shuts down certain biochemical pathways. So there are chemical pathways that have to do with dopamine and serotonin and ultimately epinephrine and norepinephrine. And when you have inflammation, you start getting distortions in the chemistry of the brain. So serotonin goes down, dopamine goes down, epinephrine levels start shifting. And this distortion starts causing some of the psychological manifestations that we see. But then there are actual changes to the neuronal pattern, so that the nerve cells themselves are sometimes hit, and we start getting, for instance, changes in dopamine regulation. So a lot of these kids, what you see is this weird choreoform movement, we call it, where they're just kind of moving, or they're having tics and their bodies are just constantly moving, which has to do with some of those dopamine centers. Their entire sensory pathways change. So a lot of these kids, can't tolerate sound, they can't tolerate smell. They're trying to claw themselves out of their own bodies because like clothing on their bodies is extremely uncomfortable for them. And this goes to some of the core kind of cerebellar pathways where the core primitive brain actually changes its functioning. The limbic system starts changing in its effects. Why these things happen, at least as far as I can tell, and the data that I've come across, I don't know if we're smart enough to actually truly know that just yet. I think in 10 to 20 years, our science will start catching up with some of this. The fact that the NIH has said like, oh gosh, this is real, like this is really happening, I think is a huge first step. And this is only in the last, I think, 2 to 5 years that the NIH actually gave recognition to this. So we're still quite a bit away from knowing all of the mechanisms. And I imagine it is way more than one single mechanism, and each chronic exposure or toxin has a different way of affecting the brain. Mold and mold has a different effect, and even the subtypes of mold, because they produce different toxins, can affect different parts of the brain. Lyme and the Lyme co-infections have different effects. Strep has different effects. So it's really complicated, and I certainly don't think there's one mechanism at play. And I wish I knew all of it. I certainly am just beginning to scratch the surface myself.
Yeah, no, and I appreciate that honesty. And it's true, like we're still, within the field of neuroscience. I mean, we all go to doctors thinking they have all the answers, but in the field of neuroscience, even the neuroscientists are like, we don't even know if we understand like 3% of how like the whole entire brain works and its relationship to the body and our endocrine system and absolutely everything else. So we're still at the forefront of this and understanding it. But I know for myself with our clients, like when I, see families that have kids that have ADHD or ADD, or other, especially anxiety and panic attacks. And, the diet we teach, it's ultimately a very nutrient dense, low caloric, but nutrient dense. Like you are flooded with nutrients, and there's none of the inflammatory triggers in there. Gluten is not that we leave gluten out because we have to or want to. It's just actually most of the nutrient dense foods that we're giving them just don't happen to contain the gluten, so we don't even have to worry about it. It's kind of a mute point. And dairy is just not part of it, only again because we're looking for the most nutrient dense, low caloric foods, which end up being the fruits and vegetables and whole grains. And they eat this, and so and the effect of that is the inflammation disappears. And then what we see are all the symptoms disappear. Like it's just a boom, 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 boom. And we see it especially with, I see a lot of young kids who are like between the ages of 18 to 25 who suffer from such severe panic attack, disorders and anxiety disorders that they can't leave the room. Some of them haven't even left the room for like a year before they eventually like make their way to me. And then all of a sudden, a few weeks later, their life is like completely different. And again, it's eliminating the inflammation, but it's the same thing with my clients who have heart disease and diabetes. We eliminate the inflammation by giving them nutrients, and all of a sudden their conditions, all of a sudden their symptoms are gone and they're off their meds. And so, and I do like that, the NIH, and as well as almost every single university that's out there right now, on their websites, medical institutions are announcing that it is inflammation at the end of the day.
And I think that that's the beauty of what you teach, right? That you build the foundation of the human being with good nutrients, and through that you change their microbiome and the gut bacteria, and you change the gut and you change the immune system. Just you start supporting detox. A lot of these people can't detoxify because they haven't pooped in a week. So by just changing some of these things and using food as literally the concrete that you pour into the foundation to then build a house on, there's so much that can be done, which is why the work that you're doing is so invaluable in this time especially.
Yeah. And I love that you brought up the poop piece because yesterday I just had a client who, she's only been doing our program for a week and she hasn't had a normal poop in 20 years and she's
Mm,
in her late 70s and
wow.
hasn't had a normal bowel
Wow.
movement in 20 years. And for the first time she did. And to me, like, I actually started crying because I was like, oh my gosh, this woman, like how she must feel to
Mm.
experience that, but you also give that to your patients as well. And I love the work that you're doing. It's so, so important, especially as we're just at the forefront of understanding all of this. So how do people work with you right now, especially given that it's COVID, especially, and we don't know, in California, it looks like things are getting better, and people are venturing out more, but how can patients work with you?
Well, I mean, right now we're really not in a place to fully launch the system.
Right.
Uh, I think if families or people are interested, we would love for them to contact us, and I'd be happy to share that contact information. So that way we can start creating a wait list. We want to get this system out, and we want to get it out as quickly as possible. And I realize that myself doing it as one person is not enough, and we're actually in the process of looking for data scientists and looking for others that can actually help us build this system. So if there's anyone out there that's listening that happens to be really like my partner is an incredible tech wizard. He is not a hardcore artificial intelligence data scientist. So we're looking to build our team, and we're looking for people that would be interested in helping us to start beta testing it, and people who are willing to be patient with us as we work through all of the bugs to get it to a point where it's prime time. But I'll share the contact information with you, and those that are interested can email us and contact us.
Amazing. And
Mm.
then for other, families and who have children who, you've talked about all the potential conditions that they may or may not have the symptoms they have. They can go to Holistic Kids. And do they have to be located in California to be able to work with you? How does that work?
We're doing some remote consultations. It's very tricky. We do generally need someone who has a local provider that we can work alongside because we can't provide medicine in every state.
Right.
So if people are remote and they have someone locally that could be their, local, foot on the ground, yeah, we'd be happy to work with them and provide guidance in that sense.
Amazing. And let's leave our audience with, especially parents out there that are listening to this, because I know that, many of them will have resonated with everything that you talked about. Many of them will be thinking about people within their community that have children, that you might have spoken about some of the conditions that they might have. So what is the first thing that a parent can do if they feel that they have a child that might be exhibiting some of these behaviors, and where they know that that child has an opportunity to maybe be alleviated from some of those symptoms? What's the first thing that they should do?
Yeah, I think if you're just getting started, really the fundamentals are food. Cut sugar out, cut preservatives out, cut food colorings out. Make sure they're eating wholesome foods that don't disrupt their blood sugar. And that alone may change, 10, 20% of the picture, sometimes more. Sometimes it changes the entire picture. So I think at a core foundational level, start with food. And then, from there, then you can get into all of the nitty-gritty details of sleep and tongue ties and mold and gut issues and mitochondria and so forth. But uh, nutrition is foundational. And I'd say, at the very least, just start with the very basics.
Yeah, I love that, because in that way parents don't have to go out there and start ripping up their walls and
Mhm.
looking for mold, or checking for, remembering every camping trip that they went on and
Mhm.
to see if, there was potentially a tick. No, I think that is, well, of course, I love that. Our podcast is
Mhm.
called Eat Real to Heal. So, I'm going to start with food as well. But it's always nice to get that validation as well. And just for parents to know that don't leave it to be the last thing that you try. Start with the food, because you're eating 3 meals a day and snacks anyway. So, It may not be easy to do because, as you know, if you don't know how to chop a potato, or if you don't know what a head of cabbage looks like, you do have to learn those things. And I know sometimes in our field, we assume that people know what food is, but, for any families out there that if, you're wondering what that looks like, there's so many resources, and I'll be sure to include those resources, with really simple cookbooks that you can follow, that, you don't need to be a 5-star chef to
Yeah.
prepare really healthy meals for your family. You can keep them really, really simple. Especially for kids who have sensory disorders, sometimes just, trying a cooked carrot versus a raw carrot, or something like, and just testing it out on kids. I often say for parents, if your kids don't like vegetables, you got to try it 19 different ways, 19 different times, and your child will eventually love
Amen.
vegetables. And it's just figuring out what texture that they like, what
Yeah.
flavor that they like,
Yeah.
but don't give up, because it truly is medicine. Your food is your medicine.
Yes.
Well, it has been such an honor having you on the show. There's
Mm.
so many other topics that, I would love to dive into. And, I tend to fall in love with all of my guests that we have on there, because you're just such a wealth of information. And I just appreciate you taking the time to share that with our audience, with our listeners. So thank you so much for your time on the show.
Thank you for having me, and it's been a pleasure. And thank you for taking this information into the world and helping people see things differently, and helping us transform the world into something better for more people.
Yeah, well, it's all going to be done through storytelling. So you've shared your story
Mhm.
today, and I know you have so many more stories to share. So I look forward to helping you get your stories out there for
Thank you.
sure.
Thank
Thank
you.
you. Okay, bye everyone. See you on the next show.
Again, another incredible human being on our planet doing incredible work to bring health and healing not only to kids, but their entire families, which ultimately resonates out into building healthy and resilient communities. So you know where to find Dr. K. Check out the show notes below, and definitely do not wait a second longer before you start seeking help from holistic practitioners who want to help create healthy kids. Dr. K is definitely one of those individuals. And before we go, I just want to make sure that you head on over to our website at 22millionstrong.ca, and you also follow what we're doing, making a documentary with Inlight Films. Inlight Films, they are an incredible group that they make documentaries and films that heal the soul. So the minute we met them, it was a perfect fit, and we hired them right away because they have the magic. They know how to bring all the incredible work that we've been doing to the screen, and to be able to hopefully inspire more and more people around this globe to take charge of their own health, to not wait to turn their health around, not wait to reverse the chronic disease, to learn about food as medicine, to learn about the food of your ancestors, because guess what? The food of your ancestors kept your ancestors healthy for millions and millions of years. And we need to revert back to those beautiful, wholesome, organic, unrefined, unprocessed foods that your ancestors ate, so that you can reclaim your health, reclaim your life. And that's what this documentary is about. It's about my journey finding out all about food as medicine. I was like you, I was born into this world not really knowing about it. Nobody was teaching me this in school. My doctors definitely were not preaching this. And now I've been fortunate enough to meet enough humans to be able to dive into the research, to be able to study this extensively over the last 20 plus years. And I'm going to take you through my own journey, finding out and discovering food as medicine, so that you can also start and continue your journey towards optimum health. So you know what to do, folks. What do I always say in every show? Share this podcast with someone that you know, someone that you love, because Dr. K and his message and the work that he does might just be what a loved one in your world needs to be able to turn their health and their life around. So press forward, press share, and email this on, text it. You know what to do. Thanks everyone for being here. Stay tuned for yet another episode of the Eat Real to Heal podcast next week. Bye.